Good morning, good afternoon, and good evening. Whatever time you are watching this, I greet you. How are you? How have you been? It's amazing. It's still just 2 3 months of the year 2022, and we pushing on like never before. We're working hard than never before. We are trying to make sure that we make ends meet. So thank you so much, each and every individual that is trying so hard to make sure that they get the best out of themselves. Hosted by Grand Global Hotel, the only one super excellent hotel that we have in Uganda, and for it's located along off Makerere Hill, that is along Sapolokagwa Road. So if you're out there and you have interest in maybe partnering with any hotel, or you would want any services that are being offered from any hotel, Grand Global is the only place that you can look out for. And it's a big list of the different services that they offer, but I'm just going to give you a few services, and for you, maybe you will try to call them and you ask about any service of your interest. For them, they offer they have meeting rooms or conference halls. They have a restaurant. They do have a health club. They have facilities for the disabled. They do have outside catering. They do have wedding planning services. Talk about wedding planning services. Some of us do not want to go through the hassle of planning our weddings, or we want people to sit and plan for us and we just appear. So Grand Global says, don't worry about that. They'll plan your wedding. So if you want to get more information about what's happening around the hotel, you can call on +256 039 351 6620. Or you can also try to call on +256 075 642 8031. Those numbers are over the screen. Copy and call, make an appointment, or ask. They'll give you the best information that you're looking out for. Or you can visit their website, which is www.grandglobalhotel.com.ug. That would be giving you a lot of information about what they do offer. But well, today on the Inspiration Corner, UG, I'm privileged to have an expert, a medic. Obulamu tetuwawula ku bya bulamu, what we call health. So today we on to the health hour, and we want to discuss health matters. But before I welcome my guest, I want to urge you to subscribe, hit the notification bell, and leave a comment on the comment section. I'm privileged to have Dr. James Ayembisiwe from Care Medical Center in Zambia. So he's just help me welcome the people on the show, and then we start off.
I welcome you all. Dr. James Ayembisiwe is my name, as so said. And I want to call upon you to be attentive, because today we have a very serious and sensitive topic to discuss about: your health, her health, his health, and your neighbor's health. Thank you.
Thank you so much, Doctor. That is Dr. Ayembisiwe James from Care Medical Center. He's a medical practitioner and he's a licensed doctor. Well, today says we're going to talk about a serious issue and something that we've ignored for a long time, and those are the sexually transmitted diseases. Sexually transmitted diseases. I know many people do not want to talk about things to do with sexuality. They feel like, but why not? Let's talk about sexuality. Let's talk about those sexually transmitted diseases. I've been telling Dr. James that nowadays to HIV, and then he's told me a list of the different STIs that we should also fear. But doctor, tell us, STDs, STIs, are they the same? They're the same.
Before that, first of all, I want to inform the viewers that you have a right person to ask such a question. I call myself a senior medical officer because I've completed more than 5 years in health practicing. And generally, doctors, we are seen as public servants. We are, because on average, we see every kind of a human being. General practitioners are licensed to see all kinds of patients categorize them before being sent to their areas of specialties to be seen by the specialists.
Okay.
So when you ask me about sexually transmittable diseases, allow me, viewers, to take you through shortly how God organized a human being.
How?
God, the Creator, organized
Organized a
a human
human
being.
being.
Now, human being is organized right way from a smallest unit called a cell. Now, the number of cells makes up a tissue. Tissues they are organized in that they have specific arrangements of functions in our body. They differ in different functionalities. Now, these tissues adds up themselves to make up a system. Then it is these systems that makes up a human being, a complex a complex functioning human being. Now, when we talk about sexually transmittable diseases, we are looking at the diseases that really harm, attack reproductive system among the functioning body systems that God made to the human being. So, when you attack reproductive system, you've attacked fertility system, or the system that is responsible of reproduction, of multiplication, of multiplying human beings on this world. So it should not be seen in the sphere of sex, should be seen in the sphere of reproduction. Sexual intercourse was created for multiplication, not for pleasure only.
Yeah.
Only that pleasure now comes in because, in the age differences and all that. But that's the instance why preferably reproductive system is seen. So when we talk of sexually transmittable diseases, we have to look at two issues. One, sexually acquired transmittable diseases,
Okay.
and acquired transmittable diseases sexually. Now,
Sexually acquired
and acquired transmittable diseases
diseases.
that are preferable. So that's why we call them STIs,
Okay.
sexually transmittable infections. So you can easily acquire it directly through sexual intercourse, or you can acquire it from the environment, preferably of an infected person who definitely practiced wrong sexual intercourse and acquired this disease. So this is how we need to discuss these diseases from. And on top of this, environmentally, we have been acquiring these diseases, but we don't know how to differentiate the two. One, urinary tract infection and sexually transmittable infections. Maybe, could be because these organs relate to each other
each
in terms
other.
of functions.
But I think we're going to be helped getting to know how a urinary tract infection present, a bit of it. Then we can also get to know how these other sexually transmitted diseases present. Because every time we've seen people go to hospitals and then they're like, check an infection, it's kaita, it's bakaita kaita. But we need to differentiate that too, and also, but we want to put a lot of emphasis on the sexually transmitted diseases. And also, I would want to understand the health burden or the problem statement, or the health burden for these sexually transmitted diseases. Because if you say they attack the fertility rates and all that, they in line with reproduction and multiplication, let's get to know the health burden, such that as we go down to talking about each one of them, people can understand why it's important to know these things.
Very true. Now, earlier said the systems in our body have different functions they perform for a human being to move and do other important, preferably, functions within this world. Now, urinary tract infections comes in. These are the infections that affect the system that is responsible of production of urine and definitely excreting this urine from our body. Urine is formed and then prepared to be put outside as a waste product. Now, why I say these two agents have the same similarities and preferably they are friends, just because their organs almost they are located in the same area. So when we are talking about sexually transmissible diseases, UTIs, remember sexually transmittable disease can advance once treated badly or once mishandled on looking at that presentations may advance into urinary tract infection and which eventually may become harmful. Because once urine production is interrupted by any disease, then a human being is in trouble of losing life. That's what I should say. Though in most cases, sexually transmittable disease may not really harm your life immediate, but may be having future implications in reproduction systems.
Future implications.
Yes.
Okay. Well, now we can start with the sexually transmitted diseases.
Sexually transmittable diseases. There are quite many.
Okay.
And
Let's
these
have
are
that list.
these are the diseases that in our society we can call oburwadde obwekikaba. This is a disease that these categories of diseases we normally get out of, I should say, happiness, because you have entered into sexual engagement because you are looking for happiness or you want to reproduce. So eventually, sexually transmittable disease is acquired from a person who is already a patient of sexually transmittable specific disease that you have acquired today. That's what I should say and inform our viewers that you only acquire a specific disease you have acquired from this partner because this partner is ill of that specific disease. And this disease is always, we should call it moving from one client to another, from one human being to another, by the specific microorganisms. As in medicine, we call it pathogens. So I cannot acquire a specific, let's say, pathogen or microorganism that is responsible of gonorrhea, and then I suffer syphilis. It can't be. I have to suffer gonorrhea, exactly the gonorrhea that I acquired from the other partner of mine by the time we engage into sexual intercourse. Exactly. So that's how it moves.
Just like I mentioned earlier, we believe that, okay, we just, not even believing, we're very sure that HIV is sexually transmitted, and then it's hard, for example, when people are going to have sex, to think of any other thing besides HIV and getting pregnant. Yeah. But I think that is why we're here tonight, to address the other infections that people can get if they have unprotected sex or intercourse.
I should even say this in front of our viewers is that just because HIV got a chance of media attraction, but there are quite many sexually transmittable diseases that are dangerous. We can't compare them with HIV just because HIV as yet, we are not yet sure of specific treatment, but we are sure that we have passive treatment of HIV, of which you can be on drugs for, and even be, preferably your life may go because of other agents, but not HIV. Though the fear of HIV is that it attacks your immune system, that gives opportunity on other diseases to affect your life and weaken it, which may as well take your life very fast. If you can allow me, give you a few of them that we may not really complete because research is still going on.
We can just break down a few.
We are still even having new on board. The most common ones that we normally get on our practice, like I've told you, I'm very seriously active practitioner. We normally find this out of investigations of urine and blood. We normally find syphilis, We normally find gonorrhea.
What syphilis in Uganda is?
I should say, I normally hear my clients call it kavotongo.
Oh, okay. Then gonorrhea.
Then gonorrhea also is also called kavotongo. Maybe it could be Nziku, the gonorrhea now. Yes, but the most common significant presentation and the differentiation between gonorrhea and syphilis is that with gonorrhea, once you acquire it, it cannot give you a break more than 24 hours before getting the symptoms, the Nziku. And it comes with a lot of vigor, with a lot of, serious symptoms, pain, past discharge and all that. So you can easily tell really where you came from yesterday wasn't good. But though with the syphilis can keep you more than 7 days, even more. Yes, so it keeps, their presentation with syphilis keeps on coming slowly. Allow me also to inform our viewers that there is also this enemy that is so serious, mostly to our mothers these days, and agents are seriously transferring them, called HPV, human papilloma virus. This is a very seriously, acquiring virus that our mothers and our papas are moving it from one agent, one mama or one papa to another, and it's too dangerous in that it has really taken most of our mothers and our young mothers so far, in that its end product is to cause cancer of the cervix. And now, the most fertility part of cancer of the cervix is that by the time you come to know you're suffering from cancer of the cervix, most of our health practitioners have treated you several times of a wrong diagnosis called sexually transmitted infections. Just because it presents with, PV discharge in women, it keeps on reoccurring. I have discharge. By the time you present with a discharge to any health worker, first thing to do is to take your urine, and then they look at the deposits in urine and give you antibiotics. So by the time you come to that tertiary institution to investigate more about your reoccurrences of PV discharges, preferably it has eaten up these other adherent organs like ovaries, and even your uterus is also partly eaten up. What does it mean to a cancer? It means there is no reverse, no specific management, and you may end up preferably be told that you're going to be on painkillers until your life goes. That is the most dangerous part of it. Should you also talk about the discharge?
Okay.
The agents that are always confusing in our practice and normally confuses our clients.
Yes.
When mostly to the females, even the males as well, present with a discharge, they can't easily tell what kind of discharge do I have and why. Because the same as how I have a PV discharge. So most common one is the whitish curdled milky.
Whitish?
Curdled milky. It looks like milk, like dead milk. Some people even confuse it with yogurt. I'm sorry to say so. But it's like dead milk. Now, the other one comes in with either brownish or yellowish. Now, the causing agents of these discharges are different. In that the other whitish curdled milky sometimes presents with itching.
Okay.
This one may not present with itching, but with quite stingy smell, different, no bad smell. So the other one is a bacteria origin. This one is a fungus, the one that is itchy. So mostly we need to end this confusion. The confusion is between which kind of specific treatment do I need to take and for what? The brown, yellowish, bad smell, bacterium, antibiotics. The other itchy one with kind of like gone bad milk is a fungus. Definitely antifungal treatment. That's what I can say. And all these can be isolated well when you give time your health worker, takes very good history from you, relating it from when these symptoms started, and then will make a very good choice of investigations like urinalysis, urine culture sensitivity, can even go further by doing a pap smear of these, deposits that you have started producing, and then they come up with specific microorganism and give you very good treatment. My recommendation on this, not every STI is good for you as a client to go and ask treatment. Better find a health worker.
Well, so far you've mentioned about, besides HIV, you've mentioned about syphilis, gonorrhea, and then HPV.
HPV.
HPV. Can you just give us a list of,
More?
yeah, just
Oh,
give us a list, because someone will be like, oh, those ones that I've mentioned, I'm good. There is no nothing.
there are some that sometimes present in a short occurrences that are uncommon, mostly like herpes. A major piece of herpes can be seen in immune deficiencies
Okay.
clients, those with cancers. It was mostly seen. It was mostly seen in HIV late infections. Those ones called zoster, herpes zoster, oba kye bayita mu Luganda ekisipi.
It's, yeah, huh?
But there are other CCPs, baby CPs categories that we normally acquire and suffer from unknowingly. And preferably because of our good immunities that we have, or because of beating around the bush and self-medicating,
Yes.
they normally escape. Yes, those herpes 5, herpes 6, herpes 3, they normally produce burning blisters on our body and sometimes in our private parts.
Okay, thank you so much, Dr. But you are watching the Health Hour on Inspiration Corner UG. So kindly subscribe, hit the notification bell, and then leave a comment. We're talking about we're trying to understand actually the different sexually transmitted diseases, but our main target here, we want to look at of how we can prevent them and how we can manage them. Doctor mentioned earlier when he was explaining that some of these sexually transmitted diseases are managed wrongly. Yeah, you just happen to be like, maybe you have an infection, and then you go just self-medicate. You do not go to the hospital. Even when you go to the hospital and then they tell you carry out these particular tests, you're not ready to do that in the name of I'll be fine. And we've also tried to confuse them with urinary tract infections, but I think you've gotten to know where the difference is. The reasons as to why we're here now, we want to mainly target the prevention to those that have not yet suffered the sexually transmitted diseases, because we believe amongst us in our communities, there are people that have those sexually transmitted diseases, but there are those ones that do not have. So we want to look at the prevention and then the management to those ones that already have the gonorrhea, you have the syphilis, the herpes, the HPV, and there's so many others that doctor is mentioned about. How can they be prevented and how can they be managed? And even besides, doctor, maybe before we go with zero to the prevention and then the management, what are the indicators or the manifestations? I think you can just point out maybe syphilis, gonorrhea, HPV, and what else, like 4 of them, and give us the cardinal signs that if you present with ABCD, you most likely, but that doesn't mean you shouldn't go to the hospital.
The few of the manifestations that most of our clients normally face, we need to categorize this in short term and long term. But I think the most wanted ones by our clients, by our viewers, are the short term ones.
Yes.
But the long term ones are dangerous. When I talk of the long term, I mean definitely HIV. HIV can keep you for even a year without knowing, without getting any symptom.
Okay.
But eventually, which is totally dangerous. So we need to, first of all, most of our clients know that once you indulge yourself into sexually related, affairs, sexual intercourse that is unprotected, you should always expect this on your way within 24 hours. One, do you have any itching on your genitals? And genitals, I definitely mean the edge, the weapon that you use to play sex. If you're a man, you understand exactly what I mean.
Okay.
If you're a woman, you understand exactly what I mean. So, first, within 24 hours, you will definitely experience itching. You may experience painful or difficult in passing urine.
Urine.
There is a difference between painful and passing.
Okay.
Some individuals, according to the pathogens, according to the type of infection you have acquired, may experience burning sensations within that area or within the region itself. And preferably, the most closure one is lower abdominal pain. Now, to either the side of a lady or the side of males. You need to understand this, that most of these infections normally manifest their presentations faster in males than females. And why this? Just because in males, we have quite a longer urinary tract, tube than the female ones. I don't know that I'm got clear on
the
this.
ones for the females is short, then for the male is a bit long.
Exactly. So most males normally get these symptoms faster than the females. So it's very possible for a female to be having, let's say, chlamydia, which we have mentioned of the one that is responsible of discharges, or gonorrhea, or syphilis, or herpes for some time without getting these symptoms serious. Exactly. And for males, it's quite rare. Within 24 hours, they will definitely feel the pain. They will definitely feel like they have to go to the hospital. Yes, please. That's what I can say about that.
But well,
Few of them.
then you said there are the ones that are long time that you do not witness the symptoms there and
Exactly,
then,
yes.
but for after a while you can witness the symptoms.
Long-term ones, sometimes they come as complications because
For example, like in HIV.
most of our clients, even, they feel shunned. They feel it's not in order for them to go to a health worker and tell, I am feeling pain while passing out urine. Definitely, our health worker will tell you played sex, or will have to know it in mind that you did the sex with definitely a person you didn't know before, and you acquired such an infection. So at such a stake, most of them, when there is a lower abdominal pain, it may advance to definitely affecting other adjacent organs like urinary bladder may be in trouble. You may start passing out seriously, a different colored urine, burning urine with some deposits like white substances and all that. You may even preferably cease from passing urine, which
So
may be
those
totally in danger to you.
Okay.
Yes, those are one of the late presentations
presentations.
in sexually transmittable infections.
Should we believe to have long-term complications in sexually transmitted diseases?
We don't need to wait anymore. Once you
see
know it yourself in your capacity that the person you met yesterday but one, wasn't that your usual person. You did not go to any health facility for a test before starting indulging yourself into such a game. You better know, you don't know the status of this person, or you didn't know the status of this person before. Please, once you indulge yourself accidentally, we call it accidental sexual meetings, please, the next day, once you feel any small itching, burning sensation, go to a hospital.
We're
Don't
talking
wait.
of the sexually transmitted diseases, and I know our time is running so fast, but quickly we're going to run to the management and prevention. How do we manage and how do we prevent? And maybe you can tell us some of the tests that we made to do, just in case we suspect such.
Few of the tests that we need to be looking at, and on a serious note, is to accept to give out our urine for microscopy and chemistry studies. And then some other investigations like complete blood count may be as well looked at for the doctor to make a decision. Syphilis test should be mandatory every year. Please go to any health facility, test for syphilis because syphilis is highly infectious. We can even acquire such syphilis microorganisms from even the wrong areas, urinals. Some of us even share and go to different hotels, sleep there. You don't know how that bed sheet was treated before you're coming and all that. So we need to think about syphilis every year.
And do routine testing.
Exactly. So those are one of the tests that we need always to look at. Prevention. My dear moderator, think about what we are preventing. Is something that we have acquired because we want pleasure. It's a pleasure thing. So the best prevention is to think about one partner, one partner.
One partner, one partner.
That's all.
Okay.
If you can't avoid sex, think about one
Protection.
partner. But it's better to think about one partner first of all.
Okay.
If it can't work out, think about protection. But protection still, some agents, some diseases that we are talking about here can't easily be avoided by using a condom, like HPV, human papillomavirus. Yes, you can't avoid it. So it's better to think about a partner that you have gone together to a
For
health
testing.
facility for testing and doing all these screenings. Every year as a partner, as a couple, think about going to any health facility for HIV, for syphilis test, and other important,
Can you just help me re-echo that? For partners, what should
for
they
couples,
do every single year?
for partners, every year, think about screening for HIV,
HIV.
screening for syphilis, and preferably for our mama, go for HPV screening, the cancer of the cervix screening. It's very important.
Sure.
Give out your urine as a couple. Let the microscopist or your doctor attending screen and tell you in case of any deposits present, we'll definitely prescribe for you a better treatment.
Okay.
And then move on as a couple. The most important thing is know where your footstep is going to go. If you are not sure, then better go to a health facility for screenings and get treated well. That is the best prevention that we can really air it out.
Let's look at the management. How best, as in best, can we manage this infection?
Before we go for management, I want to inform our viewers that bedside screening HIV is dangerous to you.
Bedside screening?
Bedside screening for HIV is dangerous for your life. Why am I saying so? HIV takes some good time in a human being as it is trying to replicate, to multiply in your body, for your body to detect that there is an agent and produce antigens, then antigens to antibodies that we can easily detect positive.
Okay.
What am I trying to say? This person you're testing right now, because you have to sleep with right now, maybe having HIV viruses that cannot easily be detected at this
moment.
time, but may be in danger to you when you play with her or him without a protection. Because better you have screened it today and the bedside is negative. Then preferably next week you'll meet without testing. So maybe endanger to you. It's better to take time, screen, and take some good time, 2-3 weeks, and then screen again. Then know what you're going for.
Hope we get that kind of patience.
Management. Short time presentations need quick management because earlier said it may be in danger to your urinary system, it may be in danger to your reproductive systems. So once you have any presentation that you feel uncomfortable of, please, you need management. Management we are talking of here is a management that can be prescribed by a trained, skilled health practitioner, not Dr. Gugu, not Dr. Friend, because we know we are Africans, not even Africans worldwide. We have so many friends who know how to prescribe for us. The other time I had also the same problem. I took this. This is totally dangerous to you. Find a health practitioner that can take you through a questionnaire and look at the best investigation to do and find the best treatment for that specific microorganism. Because urinary tract infections, sexually transmittable infections are many. And once you mess up with the specific treatment, you have messed up with the management. So you will not be fine. And once a sexually transmittable disease is not treated right, it will cause more problems to your two systems, as earlier said, reproduction system and urinary system, which definitely need to remind our viewers that urinary system, we are looking at kidneys, of which kidneys are very hard to be repaired once damaged.
Wow, those are long-term complications that you would not want to get. And well, just like I told you, time is not been so kind to us, and we would just love to do an overlap of all this. And but I think there are people that would want to ask as many questions as possible, and I'm going to request Dr. James Imbisiwe to just give us the details of the medical center where we can find him and maybe his personal contacts. If you want to, don't consult on phone. I usually tell people not to consult on phone. Just call him to make an appointment and run to the hospital. So do an overlap, the last words, and then tell our viewers where they can find you.
This time telemedicine is very serious globally. So many clients meet their doctors on different apps, those apps that are registered and they are being followed up by their councils. It's possible to meet a qualifying doctor on an app, but you need to know what kind of app I'm using.
Yes.
I'm fully employed by Kia Medical Investments and Kia Medical Center in Zambia, that is located at Zambia, Katwe. I work full-time, 5 days I'm there.
Okay.
And I'm sure I've been there for more than 7 years, and I should say I've been trusted by most Ugandans and outside Ugandans.
Okay.
So that's why you can easily find me. But I'm also very common on my social media handles of Kia and Dr. Ahimbisiwe James. Most of those social media handles are there. So you can still spot me out as Dr. James Ahimbisiwe or Kia Medical Center or Kia Medical Investments. Yes, you can still get me there on 0782 477 517.
Your last words, doctor, about STIs?
Sexually transmittable disease is a danger to your reproductive system. Maybe a complication, and a very serious complication to your life, as it may as well endanger your urinary system, which is a kidney, which may lead you to death. So once contacted sexually transmittable infection or sexually related disease, please find a health worker for better investigation and management. Thank you very much.
Thank you. Thank you so much, Doctor. We're very, very delighted as Inspiration Corner AG and for you accepting to be on the Health Hour.
A pleasure.
And well, to our viewers, I would say thank you. Thank you so much for being hosted today by Grand Global Hotel, and we're partnering with Grand Global Hotel to tell you that it's the best hotel where you can enjoy all the services that are offered in any hotel here in Uganda. It's very convenient. It's not too expensive and it's not cheap. Not too expensive, but it's not cheap. So the costs are really, really very friendly. The numbers are over the screen that you can call from Grand Global Hotel. They can, just tell you about the services they have. Come through and enjoy the best experience at Grand Global Hotel. For them, their service is with excellence. So till next time, I remain Gift Nakainda. Bye-bye.